This week we're going to do the top 3 exercises for thoracic outlet syndrome. And thoracic outlet syndrome is an umbrella term that encompasses a lot of different symptoms. Most commonly, at least what we see in our clinic, thoracic outlet, which is right here, and it's where the nerves from the lower part of your neck branch out off of the spinal cord and then run down into your chest, shoulder, arm, and then shoulder blade as well. So symptoms can be anything from burning, shooting pain. Most commonly in the clinic we see a numbness with the pinky and ring finger right here. And commonly when we talk with those people, they'll sleep like this, or they had some sort of injury where they landed in this position, or they might sleep on their side with their arm extended, or sleep with their arm folded forward. And what happens, their shoulders shrug forward, and what happens is that nerve bundle, it's called the brachial plexus. You can Google it, but that brachial plexus gets closed down. It can cause nerve symptoms, and then there's a major artery right there as well, which can be closed down or pinched upon, and that'll create some changes in temperature and changes in blood flow within the arm. Top 3 exercises that we do for thoracic outlet syndrome. Number 1 is this. There are 3 major nerves that run down the arm the whole way into the hand: radial nerve, median nerve, which is the carpal tunnel nerve, and the ulnar nerve, which is the funny bone nerve, which runs in a groove right behind your elbow here. And to stretch the ulnar nerve, the first thing we do is this. Make a circle with your index finger and your thumb, touch them together, turn it upside down, raise your elbow up in the air. You should, if you have symptoms along that ulnar nerve, you're going to feel a pretty intense stretch here. So some people in the beginning, this is all they can do, but eventually they want to work up to this point right here. In the clinic we do a 30-second hold for 3 times. So that's the ulnar nerve stretch. For the radial nerve stretch, what you can commonly do is go against a post or a wall, so the back of your hand's up against the wall. I'm going to show it to you like this because it's easier than me doing it at this angle. But you're going to go like this. Good posture, lean your head away. So I'm pressing the back of my hand up lightly against the wall just to keep my hand down in this position. I'm leaning away, and that stretches the radial nerve. And then the median nerve, you just flip it. So your palms up in the air, up against the wall. Same idea. For both of those stretches, we do a 30-second hold 3 times. So normally we do the top 3. I know I've already shown you 3 exercises. The 4th and most important is this. Good posture results in less pressure on the nerve, less pressure on the artery, and less symptoms in your arm. So we want to do something for that as well. This is probably the most common that we see, or the most helpful exercise that we see for posture. And it's simply this. If you have one of these half foam rolls, really helpful. If not, what you can do is use a rolled towel, and we do this in the clinic as well. And then for people that don't have a half roll at home, or a half foam, they can use this. But you place this directly on your spine, and you just chill out. In the clinic we do 2 minutes. So my shoulders are down and back, and I'm resting in this position for 2 minutes. And what this does is it opens up the chest, puts you automatically in good posture. If you can tolerate that, great. And it opens up this space where those 3 major nerves and that nerve bundle called the brachial plexus, and also that major artery, the subclavian artery, travel as well, relieves the pressure on that. Top 3 exercises for thoracic outlet syndrome.